Welcome to this session of Coaching Veterans, where we focus on foot and ankle conditions, including flat feet, plantar fasciitis, and ankle injuries. I'm Paul Bunn with Veterans Outreach Ministries. Today we'll go over how the VA rates these conditions, how to prepare for your C&P exam, and how to present your case clearly and confidently. Foot and ankle problems are some of the most common service-connected issues for veterans. Years of long marches, wearing boots with poor arch support, jumping from vehicles, or carrying heavy loads can cause lasting damage. Conditions like flat feet, heel spurs, Achilles injuries, or chronic ankle pain often start small but get worse over time. During your C&P exam, it's important to explain how your symptoms have progressed. There are two main paths to service connection for foot and ankle problems. Direct service connection means you were treated for an injury or chronic foot pain while in service. Secondary service connection means your foot problems caused or worsened another condition like knee, hip, or back pain from an altered gait. The best evidence includes service treatment records, therapy notes, and statements from people who've seen how your condition affects you. The VA rates foot and ankle conditions under the musculoskeletal system, Section 38 CFR, Section 4.71a, diagnostic codes 5276 through 5284. Ratings depend on pain, deformity, swelling, and functional loss. They range from 0% to 50% based on how much your condition limits your ability to walk, stand, or perform daily tasks. A 0% rating means the VA recognizes your diagnosis but finds little or no impairment. You might have mild soreness after long activity, but no real functional loss. Example, occasional soreness after standing all day, no need for medication or supports. Even at 0%, it establishes service connection, which can later be increased if symptoms worsen. A 10% rating applies when pain shows up with use, when arches start to flatten, or when mild swelling is present. You may use inserts or orthotics every day for support. Example, feet ache after short walks and inserts are needed for daily comfort. This level shows that pain is consistent even if manageable. At 20%, pain is more persistent, sometimes even at rest, and swelling or instability may occur. You may find it difficult to stand or walk for long periods. Example, unable to stand for more than 30 minutes without sharp pain in the arches or heels. This level reflects a noticeable impact on work and daily life. A 30% rating represents severe impairment. Flat foot deformity, tendon spasms, and constant pain are common. Orthotics and braces may not help much. Example, walking with a limp, arches collapsing completely, pain that limits activity. This rating recognizes major loss of mobility and endurance. Ratings at 40 or 50% indicate near total or total loss of function. You may require a brace, cane, or help walking. Example, unable to walk safely without support or unable to perform daily tasks due to pain and weakness. This level represents loss of independence and full impairment of the foot or ankle. Before your C&P exam, take a few minutes to evaluate your condition. Ask yourself, do my feet hurt when walking or standing? Do I use orthotics or braces? Do I have swelling, numbness, or ankle instability? Does this affect my job, chores, or hobbies? Keep a 30-day symptom diary to track pain levels and activity limits. This makes it easier to recall details during your exam. During your exam, be honest and describe your worst days. Bring your orthotics, braces, or medical devices with you. Talk about how your symptoms limit your daily life, work, standing, walking, or even sleeping. Example, after walking, feet swell and make it hard to stand long enough to cook or clean. Your examples should show how the condition affects real activities. Statements from your spouse, friends, or coworkers can help your claim. A spouse might write that you limp after short walks and need help with daily chores. A coworker might note that you often sit down to rest your feet during shifts. These statements confirm the severity and frequency of your symptoms in daily life. To strengthen your claim include podiatry or orthopedic evaluations, x-rays, gait analysis, and physical therapy notes. A 30 to 60-day symptom diary. Layer buddy statements. Example, submitting medical records and a spouse's statement describing how your condition affects your routine. Strong evidence and consistent statements create a clear picture for the VA. The VA rates foot and ankle issues based on pain, deformity, and how much they limit function. Be honest, be detailed, and stay consistent when describing your daily limitations. Helpful resources include 38 CFR Section 4.71a Musculoskeletal System, VADBQ foot conditions, including flat foot. This presentation was brought to you by Veterans Outreach Ministries. For more help, call 1-888-330-1942 or visit www.vetcenters.org. You've served your country. Now it's our turn to serve you.